If you look at systems today, and I'll go back to when I graduated medical school, it was the doctor and the patient. That was what I had to be connected with. I occasionally had to connect with the hospital because I needed to do something for me. Now, if you think about it, in connectivity, you have to think about who am I dealing with, who am I leading up to, because there's people above me in the system now, and what are the resources in the system that I have to bring to bear to make this an effective interchange. Now, if I'm leading the system, if I'm the CEO of the system, it gets even more complex because I have a whole host of people underneath me who work for me. I have to make sure they have the tools. I have to make sure they're validated in their job so that they're willing to work for me and they want to work for me, because if I'm loyal to them, they will be loyal to me. I also have a boss. I at least have a board of trustees. That's the minimum. I usually have more than that, but I at least have that above me. I have to answer to them. My decision making has to make them happy. So I have to be cognizant of that at all times. And then I'm trying to bring the different parts of the system together. I'm trying to bring finance, I'm trying to bring cardiology, I'm trying to bring orthopedics, I'm trying to bring facilities management. I'm trying to bring all of those systems together to deliver something called healthcare. So it becomes quite a complex process. And if people think of only working one way, like, well, I only have to make sure the people underneath me are doing the job, and they're not thinking about who they're leading up to, and they're not thinking about how the other parts of the system are functioning, they're not really connecting. So that's what we call connectivity, the ability to connect all of those things together.
And this really speaks to the greatest challenge facing leaders in the system today. In the good old days, as Barry mentioned, it was individual parts that would bill, that would perform a certain procedure, or that would interact with the patient. Now we're talking about all of those parts being connected. And so being able to understand that enterprise, being able to build that connectivity, and being able to leverage all of that different work towards a common end is really what meta leadership is all about, and really what connectivity of effort is all about. And it's very complex. And that, in our minds, is what's very exciting about leading in healthcare today.
And increasingly, the patient experience is being used as a lens to judge the quality of the healthcare system. And when you think about that, the patient experience doesn't just include the clinical care they receive. It's everything from a smile that the receptionist gives or doesn't, the ease of making an appointment or getting follow-up care, the clarity and compassion the physician shows during the course of the care. It's the cleanliness of your cafeteria. It's the price of the parking for the guests who come or visitors who come to visit that person while they're in the facility. There's all these elements that go on a much longer time span, and things we used to not worry about so much and say, oh, all they care about is this piece. No, patients now care about that piece, and they judge you, and regulators also are judging you on the whole experience. And there are connections all the way through there. And when you leverage those connections, you do a much better job, much more efficiently and effectively. When you ignore those connections, things break down, and you have real trouble.
And that patient, Eric, that patient that Eric just described, dealing with all those things, that patient is not a patient in themselves. They're part of a population of patients. So I have to figure out, how do I deliver all of what Eric just said to the entire population and keep the individual happy? So it really becomes very, very complex and very difficult to do that.
And what Barry and Eric are referencing is really the whole of whole image negotiation. And that's what population health is all about. That's really understanding the full experience of the patients who are in the system, and then understanding how to put those pieces together so that at the end of the day, you get a system that's really working for the population, and a system that's able to operate successfully in a very complex business environment.